like every day.
That's great.
Yeah.
That's a blessing to have a job in
Yeah.
a topic you love, right?
Yeah. It's tired, but thanks to Lord because I have a job.
Yes, yes. It's important to be grateful. Blessings are coming all the time if we do it. Give me a second. I'm trying to get to the YouTube live stream, but I don't know what's going on. Okay. Well, I hope it works. Hi, Mario. Hi, Joe Harold. Hi, Fabiola. Claudia, everybody. Okay. Bernarda, give me a second. A ghost is coming inside. Okay, I'm back. Well, everybody, please, I need your cameras turned on. And if there's any trouble, please send me a message to consider it, right? Because the camera is a check view of your assistance. Hi, Mario. Okay, Mario, John. Bernarda,
Hi, teacher.
how are you?
How are you?
Fine, fine, just fine. Everything's okay. Okay. Can you listen to me clearly?
Yeah.
Okay, perfect. So let's start because as I was telling you yesterday, we have lots of topics to check today. And it's a extremely long activity and presentation. I'm trying to do it not so hard, but there are many topics to check. So let's try to do it a little faster, okay? Okay, can you see my screen?
Is loading.
Yes.
Yes.
Is okay? I'm get it organized. Well, yesterday we were talking in the workshop, but today we are going to talk about lots of inner organ systems and all the necessary vocabulary. So let's start. Today we are going to see the respiratory system, heart and circulation, cardiovascular system, urinary system, and gastrointestinal system. There's a lot of topics. In heart and circulation, of course, the principal view is for heart and heart situations, right? For vessels, of course, I'm trying to get a is having trouble. I hope I can work on it. I hope I can improve it. Can you listen to me? Is everything okay now?
Yes, it's okay.
Yes.
Okay, let's share again the screen. Okay, can you watch it? Okay, let's go.
Yes.
Mm-hmm. Give me a second, please. I'm going to check what's going on. Give me a second, please. Okay. What's happening with this? Well, we have the respiratory system, cardiovascular system, urinary system, and gastrointestinal system. I tried to make it as specific as I could, okay? So let's do it. We have here the respiratory system properly written down, and into parentheses the pronunciation. I think, well, I couldn't get all of the getting into the presentation, right? Well, I need a volunteer, please, for reading. A minute, please. Maybe John Harold.
Yes, teacher.
Yes, please read this slide.
Okay. The respiratory system is the network of organs and tissues that help you breathe. It includes your airways, lungs, and blood vessels. The muscles that power your lungs are also part of the respiratory system. These parts work together to move oxygen throughout the body and clean out waste gases like carbon dioxide. These include the nose, throat, larynx, trachea, bronchi, and lungs, also called respiratory tract.
Perfect. So we have our anatomical review. As always, we are making this. And we have some vocabulary here for checking and studying. So in that way, try to do it, because from this chart, these pictures, I'm going to take some homework and evaluations, right? For all the pictures I have in every presentation by slides. Here I have a little differences in the word for checking. And X-rays, of course. And in the model we have a specific studies. Just imagine a studies X-ray is the first idea I'm showing you on what we are going on working. As we were telling you in the class from yesterday, we are going to use these charts, the combining structures, forms, and functions of the respiratory system. Maybe Mario, can you read, please, the major structured and related combinating forms?
Okay.
The primary functions, of course, we know it.
We have nose. The related combining forms is nasal. And we have exchanges, air during inhalating and exhaling, warms, moisturizes, and filters inhaled air. Sinuses.
Okay.
We have sinus or sinus, produce mucus for the nasal cavities, make bones of the skull lighter, aid in sound production. We have pharynx or pharyngo, transports air back and forth between the nose and the trachea.
Yeah.
Laryngo, makes speech possible. Epiglottis, epiglot, closes out the trachea during swallowing. Trachea or tracheo transports air back and forth between the pharynx and the bronchi. Broncho or bronchial transports air from the trachea into the lungs. Alveolo, air sacs that exchanges gases with the pulmonary capillary blood. Lungs, pneumono or pulmono, bring oxygen into the body and remove carbon dioxide and some water waste the body.
Perfect. So we have the word root, the major structure, the combining form we were talking yesterday, and of course the function that of course Mario just read. Our word parts, of course, how we have I am sorry, my signal is failing. I'm trying to solve it. But please, I'm asking for my sisters to leave their meeting because I need it. Hi, Ariana, can you listen to me? Hi.
Yes. Hi.
Yes, please, can you read this slide, please?
Okay. Upper respiratory tract infection. An URTI is an infection of your upper respiratory tract. This includes your throat, nose, pharynx, larynx, sinuses, and trachea, the windpipe. This upper portion of your airway is susceptible to many bacterial and viral infections that can cause a range of symptoms with varying degrees of severity. Infections and airborne illnesses are easily spread by contact with other people and are often transferred by sneezing or coughing.
Perfect. And we have our joke here. So much more cause patients. Okay. An information chart for upper respiratory symptom. This situations are the most common, the most frequent ones that we are going to find in patients when they go to visit us and refer any particular situation. And of again, I'm sorry. It's not working the way I expect. Give me a second for trying to change the device and get a solution. Okay, can you listen to me? Oh. Can you watch my screen? I'm trying to solve it. But I think it's not.
We can see you, teacher, but it looks the same as before.
Yes, I'm losing my sign and my connection is not working as I please from going to another device. But until it gets ready, please let's try to continue with this one. The internet connection is awful at this time. Okay. Okay, patience, that's all we have. Okay, let's try it once more. Now, can you see my screen about coughing? It's okay.
Yes.
I hope it works. It works now. Okay. Can you see my screen? Please let me know.
Yes.
Okay, perfect. Belkin, can you read please this slide? I'm sorry because there's a lot of writing down text, but the black words, please, the highlighted are the vocabulary we must check and learn, please. Belkin, please help me.
Sir, I'm here. Cough. Cough is a common symptom of upper respiratory tract infection, ORT, and lung disease. A cough may be productive where the patient cough up symptom or non-productive. Where there is no symptom, a productive cough is often described as loose and non-productive cough as dry, symptom or phlegm. I don't know how to pronounce this word. May be clear or white mucoid, yellow.
Don't worry. We're going to check it.
Yellow due to the presence of phosphorulant of broad stained as an hemoptysis.
Perfect. This is spam and phlegm, as we could see now. We have this dialogue that is a very common situation by getting into our Hi, can you listen to me?
Can you repeat the name, please, teacher?
Can you listen to me? Are you there? And Johan is not there. No. Please, Ruth, let's read together this situation, okay? I cannot see him. Okay, can you listen me now?
Yes.
Yes, I'm changing device because it's not working with my computer. I don't know what's going on. I'm going to change this one, but let's try with this until it works. Can you see my screen? Yes, right. Here, this one too. Okay, Ruth, let's read together this situation. You could be the
Okay.
doctor, and I'm gonna be Mr. Hamilton. Yes.
Okay, it's okay.
Okay.
Mr. Hamilton, how long have you had the cough?
Oh, for years.
Do you smoke?
I used to smoke heavily, but I gave up a year ago.
Do you cough any phlegm?
Yes,
What color is it?
usually yellow.
And have you ever noticed any blood on it?
Blood. No,
Blood. Any problem
blood.
with your
Like in blood.
any problem with your breathing?
Yes, I get very short of breath. I have to stop halfway up the stairs to get my breath back. So these patients cannot get in a good breathing. And of course, we have our tip, the patient case notes. Again, the presentation. Let me check if it's
Yes, we
ready,
lose
and
the
if it's ready in my
presentation.
cell phone. Yes, no, let me check if it's ready into my cell phone, and we're going to work with that. Because it's not okay.
Okay.
It's not working with my PC, with my laptop. So let's change devices, and that's all. Would be better, I think. Sometimes it happens, right? Yum, 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 yum. Well, talking about respiratory system, of course, we must consider these specific situations. I mean, breathing, shorts of breathing, coughing, sneezing, allergies. Well, we know lots of topics that are necessary for us to consider into the consultation. I mean, if we cannot get the correct vocabulary, it's not easy for us to continue working with this. I mean, asking the correct questions. I hope it's now working. Let's try once more. Even my cell phone is not receiving the slides. It's not working in the way I was expecting. Okay. It got lost. It's recording. I'm sorry, guys. I'm sorry for this situation. I don't know what's going on. Certainly tonight. What a mess. to work now. Okay, can you listen to me again?
Yes, but with echo.
Yes, that's that horrible sound. Okay, I think it's corrected, right? At least the sound,
Yes,
but not this
we listen to you.
awful situation. Mm. Mhm. Where is the presentation? Patience, it's out of my hands. Okay, now it's working. Yeah, I think now it's working better. I asked for my sisters to leave the network, leave the internet for this time because it's not working. Okay, so let's continue. In this dialogue that I was talking with Ruth, we have some definitions that we study: smoke heavily, cough up, phlegm, notice any blood, notice any different color, notice something that is not normal, problems with your breathing. So these kind of questions of symptoms, specifically asking for this way of coming, are okay, there's no problem. So as I was telling you in the beginning of the classes, we must be so creative in order to ask some questions and get the correct information. In the patient's case notes, we have complaining of dyspnea and cough with purulent sputum for years, complaining purulent sputum of planes, okay? Not hemoptysis. This AE is for the United Kingdom writing down. Just with E without the A is for the American way of writing down. Both of them are correct, both of them are accepted. There is no difference while talking with colleagues. Of course, we have the message, cover your mouth when you cough, because it's important to take that care for other people. Let's talk about the snot. Does anybody want to tell me what understand for snot, for that specific word? Maybe, I don't know. Maybe Catherine, are you there, Catherine? Can you listen to me? Let me see. Or Agar, maybe, are you there?
I'm here, teacher.
No, Catherine. Sorry, can't hear you. Catherine.
Yeah, teacher.
Okay, what do you understand for snot, for that word? I mean, we're here for learning. That's great. And we have this chart for checking the colors, the differences in the situation, and of course the vocabulary that it's showing us. But what do you understand for snot? I mean, maybe could be a little confusing, this word.
Sputum is
Yes, could be. That's when we have a running noise. Do you understand the meaning of running noise? When we have, I don't know, any situation, rhinitis, for example, and we have liquids from our nose, it's a runny nose. Lots of smoky all the day. It's that emission of fluids, of liquids that could be in a different color, like we are checking this, and it has harder pieces too, not just water, I mean. And it helps to understand.
fluids, teacher?
Just fluids, but mixed with harder pieces too. I mean, fluids so soft and fluids that could be a little harder and like as if we're dry, I mean. That is snot. It's not the same as running noise. Phlegm, of course, we have these 4 possible colors. Maybe we have more, but I get this because of the vocabulary, I mean, and for understanding the differences between, because I'm going to start asking about clinical situations and we need to get it clearly. A very, very common situation, of course, the common cold. Please, Johan, can you listen to me?
Yes.
Please, Johan, read this paragraph, okay?
Okay, give me a second. The common cold.
Okay.
The common cold is an infection that affects your entire upper respiratory system. A virus attached to the lining of your nose and throat and triggers an immune response. The immune response results in a congestion in the local area of your lips, your body feeling generally run down as you try to fight it. Most colds are caused by the rhinovirus, but other culprits include influenza, parainfluenza, and coronavirus.
Perfect. Here we have some little vocabulary that we must check, and that's the best. The common cold is one of the most common situations, of course, and that's the one we are taking in this opportunity. The symptoms, of course, blocked nose, sneezing, sore throat, dripping mucus from your nose, snot, stuffy feeling, and fatigue. Again, another picture from this. And we have a chart that is showing us the difference between cold and flu. So just for information and getting the difference in symptoms and more vocabulary, of course. There's the lithium, there's no problem. And I thought that was an interesting. Imagine the rhinovirus and influenza, the difference for getting it, and at-home cold remedies, of course, decongestants, antihistaminics, salt water, NSAIDs, plenty of fluids, vapor rub, the vaporufia, loss of rest, zinc lozenges, echinacea, warm baths. Of course, all we can make at home, as it says, and we must know about the situations when use doses and that kind of situations. I mean, we can consider this as an information and vocabulary picture. About the physical examination, we know, all of us, the technique, the correct technique. So just for practicing the vocabulary, maybe Agar, can you read it, please?
Yes. Auscultation is listening to the sounds of the body during the physical examination. Auscultation is a method used to listen to the sounds of the body during the physical examination by using a stethoscope stethoscope.
Stethoscope.
Stethoscope. A patient's lungs, heart, and intestines are the most common organs heard during the auscultation.
Perfect. So we know it. We know the correct technique. That's great. While we were talking in the first dialogue, doctor is examining Mr. Hamilton's chest. The order is the correct expression. Take deep breaths in and out through your mouth. Good. Now say 99. Of course, we know how the objective of this kind. On exam chest, early inspiratory crackles, both lungs bases plus expiratory wheeze. Specifically, these notes with the abbreviations are the ones we must be completing, checking all the time. Listening to the chest with the stethoscope may reveal presence of sounds apart from normal bird sounds. There are two main kinds of added sounds, the crackles and the wheezes, right? Claudia, do you have time now for reading, please? Is that okay for you?
Yes.
Yes, please do it. Help us reading the crackles and wheezes.
Crackles, which sounds like hairs being rubbed together and suggest the presence of fluid in the lungs.
Perfect.
Wheezes, which are more musical sounds like whistling and indicate narrowing of the airways. The sound of an asthma patient's breathing is also called wheeze.
Perfect. Here I left these links for practicing the sound, I'm practicing that way just for information. I like it. So even this page, this internet page, this is going to help you for studying and checking more situations in the respiratory system. As it says, two main kinds of added sounds. These added sounds are the biggest ones, and of course, you know the difference between all of them. Talking about the pleural friction rub, the sound heard when the pleural surface are inflamed, and its pleurisy is called pleural rub. Of course, we know it. We have the link for listening. And the doctor asks Mr. Hamilton to say 99, or in Spanish, 33, to check vocal resonance. This is important, right? May be increased as in pneumonia or decreased as in pneumothorax. We have the graph, and these words are for vocabulary, please. The blue ones. Please try to get the time for reading. The breath sounds, of course, with the correct writing down way, and more vocabulary for how we're going to find it, when, and how we're going to explore it and do it, okay? And the abnormal breathing sounds, the yellow one. Please, Ruth, can you read them, all of them, please? All the yellow one, just them.
Yes, stridor. Frequency.
No, just the yellow one, because it's
stridor.
chart.
Okay, stridor, ranky, pleural friction reel, crackle or rails, wheezes, squawk.
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 Yes, opening the mouth, squawk.
Squawk.
Yes, perfect. The respiratory patterns, of course, and its causes, again, with vocabulary. Okay, I'm going to correct it because it's not supposed to be here. I didn't check it, I'm sorry. And please, Joyce, can you read just the blacked word? For example, the bradypnea, tachypnea, and then? Joyce, are you there?
Yes, I'm here. Give me a second. I'm trying to see it.
Okay, don't worry.
Only the green ones, right?
Yes.
Okay. So bradypnea, tachypnea, hyperpnea, small hypopnea, ataxic riot, tiny stalks, air trapping, obstructive sign, I guess,
Yes,
apneustic, agonal, and apnea.
perfect. So into the explanation is more vocabulary, and in specific situations you can find this pattern, this respiratory pattern, okay? But let me correct it at the end, and as always, I'm going to send you the presentation complete. Let's continue. What happened? Yeah. And now we have our chart from the respiratory system, the pathologies that I found that I consider important. Of course, there are a lot of situations, and for information, just having the correct way of writing down. And I mean, any volunteer for reading, for practicing?
I would like to read.
Okay, thank you, Ariana. Go ahead, please.
Okay, lung diseases. Chronic obstructive pulmonary disease, chronic bronchitis, emphysema, asthma, acute respiratory distress syndrome, atelectasis, pulmonary edema, pulmonary embolism, pneumorrhagia, and tuberculosis.
Yes. Go ahead, please.
Oh, okay. Upper respiratory diseases. Upper respiratory infection, allergic rhinitis,
Yeah, perfect.
croup, diphtheria,
Diphtheria, okay.
diphtheria, epistaxis, influenza, pertussis, rhinorrhea,
Yeah,
sinusitis,
sinusitis, okay.
sinusitis, okay. Pharynx and larynx, pharyngitis, laryngospasm, voice
Yeah,
disorders, aphonia, dysphonia, laryngitis,
yes.
trachea and bronchi, tracheorrhagia, bronchiectasis,
Bronchiectasis, bronchorrhea, right?
bronchorrhea, pleural
Thank you.
cavity, pleurisy, pleurodynia, pleural effusion, pyothorax, and emphysema,
Yes,
hemothorax, and pneumothorax.
thank you so much, Ariana. That's great. Let's continue, please. Bernarda, can you do this, please? Can you read this chart?
Okay, pneumonia, name for the of a gland disease.
Yes. Yeah. Okay, give me a second. Pneumonia.
Pneumonia.
Yeah. Thank you so much. Continue, please.
Bronchopneumonia lobar, pneumonia, pneumonia name for the causative agent.
Yeah, the agent.
Agent.
Yes.
Expiration, pneumonia, bacterial pneumonia, community acquired. Acquired pneumonia, hospital acquired pneumonia, walking pneumonia, mycoplasma pneumonia,
I'm sorry, pneumocystis.
pneumocystis, pneumonia, viral pneumonia, interstitial lung disease, pulmonary fibrosis.
Yeah.
Continue.
Again, interstitial lung disease, pulmonary fibrosis. I don't know, it's double. Well, I mixed it. Please continue.
Interstitial
third one.
lung disease, pulmonary fibrosis.
This one, because it's double.
Sorry.
Please continue. I need to hear you.
Sorry. Environmental and interstitial lung diseases, pneumoconiosis.
Yes, pneumoconiosis.
Anthracosis, asbestosis, silicosis.
Yes, silicosis, just it's the same as in Spanish.
Okay. genetic
Yes.
disorders, cystic fibrosis, lung
The
cancer,
fibrosis. Yes, the fibrosis.
fibrosis,
Yes.
lung
Lung cancer.
of autism, airway obstruction, anoxia, hypoxia, altitude hypoxia, asphyxia,
Asphyxiation. Yeah.
cianosis, hypercapnia, hypoxemia, respiratory failure,
Yeah.
smoke inhalation.
Okay. Hypoxia, hypercapnia, right? And cyanosis. Okay, thank you so much, Bernarda. Let's continue. We have this picture just for information and get more vocabulary, of course, and imagine for remembering all this stuff. We'll talk about the emphysema. And of course, our abbreviations, the most common ones that we are going to use. And we are starting taking the therapy abbreviations, of course, for just going to have, and it's important for us to know them, to remember them. So let's go. Heart and circulation, cardiovascular system. Oh, it's so okay. Fabiola, are you there? Can you listen to me?
Yes.
Fabi?
Teacher?
Yes, please read this slide. Yes,
Okay.
please read this slide.
Okay. Heart and circulation. The circulatory system is made up of blood vessels that carry blood away from and towards the heart. Arteries carry blood away from the heart, and veins carry blood back to the heart. The circulatory system carries oxygen, nutrients, and hormones to cells and removes waste products like carbon dioxide.
Yeah, the dioxide. Okay, perfect. So, I mean, that's the situation. Okay, our anatomical review with lots of pictures for having the vocabulary again and again and again, different views. Okay, of course, as I was telling you, these images I'm going to use for the evaluations. These pictures are so important. Please read all of them, check the vocabulary. If you consider you need to practice pronunciation, we can do it during the workshop, or even if there's not enough time, you can write me down and then we can practice. Lots of views, I mean, that's important. And we have the blood flow through the heart, just for information and getting the vocabulary into this situation, because it's the physiology way of we should work, we should talk. As I was telling you at the beginning, like giving orders, not asking for situations, giving orders, following steps, and continue with this kind of talking, because it's the correct way when we explain this, even to patients, okay? Showing that we are sure we are talking about, okay? Wow, what happened? Our pictures, of course. If we doctors, we don't have pictures, it's not funny reading. I mean, again, more pictures for anatomical points of being checking and learning. Arteries, veins, a detailed one to the inner organs for checking. Please read it. I'm insisting on this because it's important to get the correct name of the structures, okay? And we have our chart, the one we use at the beginning for understanding what we are talking about and how we're going to use the word roots and combining vowel, okay? Maybe, John Harold, would you like to read them? This chart, please, this slide.
Okay, teacher. Major structures: heart, blood vessels, arteries, capillaries, veins, blood, related common combining forms for heart, cardio, for blood vessels, angio, vaso, arteries, arterio, capillaries, capillo, veins, phlevo, vein, o, blood, hemo, hemato. Primary functions for heart: receives blood from the veins and pumps blood into the arteries. For blood vessels, transport blood to and from all areas of the body. Arteries transport blood away from the heart to all parts of the body. Capillaries permit the exchange of nutrients and waste products between the blood and the cells. Veins return blood from all body parts to the heart. Blood brings oxygen and nutrients to the cells and carries away waste.
Perfect. Thank you, John Harold. From these primary functions, of course, we have more ways of expression. For example, pump blood, receives blood from the veins and pumps blood into the arteries. Just the heart is pumping, okay? So in order we get this way of explaining the idea, it's better for the clear communication and the correct way of expression. The word parts, of course, or with prefixes and suffixes, we know it, and we have this helping, okay? One of the most common symptoms is the shortness of breath. And of course, we were watching it during the career, and maybe one of us have a situation that has this symptom evolved. For example, I live with asthma. So if I don't get enough care, I finish with the shortness of breath that it's so hard sometimes. Please, Agar, can you read these slides, please?
Yes. Shortness of breath. Shortness of breath or breathlessness is
breathlessness.
Breathlessness is dyspnea.
Dyspnea, yes.
At first, this is caused by exertion.
Exertion, yes.
Exertion, physical activity such as climbing stairs, perfect. But in severe cases, it may be present even at rest. A patient who is breathless when lying flat, orthopnea,
yeah.
For example, in bed, will tend to sleep raised up on two or more pillows. Pillows.
Yeah.
The abbreviation SOBOE stands for a shortness of breath on exercise or on exertion or on an effort. Patient says, I get terribly short of breath climbing stairs.
Yes, it's a very, very common situation of a consult of a medical findings, okay? And when we try to evaluate this, of course, patient says, no, please, I don't want to feel that, but it's important. So we also, talking about shortness of breath, we have to consider that these sounds of breath while respiration, inspiration, expiration would confuse the heart murmurs, and we have to consider the heart rhythm. I'm sorry. Talking about the heart rhythm, the normal resting heart rate is 65 to 75 beats per minute. In athletes, it may be as low as 40 beats per minute. In extreme athletic activity, the heart rate can go as high as 2000 per minute, and the heart rhythm may be regular or irregular. In these pictures, we have the sounds we were practicing during the career, and of course with little vocabulary for practicing. Some of them are lightened, as you can see, and just for reading for information. When you have a heart rhythm dysfunction, of course, with these medical situations. And we have shortness of breath. It's a very, very difficult situation for the patients, and we go into arrhythmias, right? Johan, can you read this slide, please? Johan. 1, 2, 3. Okay. Maybe.
I cannot talk right now, miss. I'm sorry, I'm at work.
No, don't worry. I know you are out of camera, but okay, I'm going to ask you something later. Mercedes, can you read it again? Joyce, I mean, Joyce.
Yes, sir. In an irregular rhythm. Sorry?
Yes, please, I'm listening to you.
Okay. In an irregular rhythm, arrhythmia, there may be early beats which interrupt the regular rhythm, premature beats, or the rhythm may vary with respiration, or it may be completely irregular, as in fibrillation. Fibrillation is okay, right?
Yes, that's
When
great.
patients are aware of irregularity, they describe the symptoms as palpitations.
Perfect. Of course, we know we have these black and words for practice, for understand, for getting in mind, for as a new vocabulary. And this chart that is showing us the correct way. All arrhythmias result from disturbances in impulse formation, disturbances in impulse conduction, or both, right? We know it. But what happens when we get these combined situations, or maybe one is the consequence of the other one? We got clinical cases, clinical situations that of course are going to call our attention and get into a special way of understanding. Please, Mario, can you read this clinical case? Mario? Well, Ruth, can you read this clinical case, please?
Yes, clinical case. A 22-year-old student was admitted to hospital with a long history of heart problems. He had been increasingly tired with shortness of breath on exercise, orthopnea, and palpitations. A mitral valve replacement had been carried out years previously, and this had stabilized the symptoms of heart failure, but was followed by episode attract or off-trial fibrillations, which had been particularly severe for the 6 months before admissions.
Perfect. So we were talking about those first symptoms, those both ones, for getting into the topic of heart failure. Very common situation in lots of countries, of course, and we have to consider it. When we talk about the heart disease symptoms, the most common ones are these ones: shortness of breath, chest pain, nausea or vomiting, anxiety, sweating, dizziness, and of course a heart attack as a consequence, and one of the situations we are living, right? Talking about heart failure, please, if somebody wants to read it, could be nice. I need a volunteer.
Heart failure.
Okay, thank you, Belkin. Go ahead.
Heart failure occurs when the heart is unable to maintain sufficient cardiac output. The amount of blood pumped by the heart each minute for the blood it needs. It may involve the left side of the heart, the right side, or both.
Perfect. So just for remembering and having this cardiac output term, because they go always together, okay, when we talk about this specific situation. We have in left heart failure, the main symptoms is breathlessness, of course. We have this comic chart for checking the vocabulary and getting the physiopathology of the situation, okay? Left side, body supplied organs, failure leads low organ perfusion and hypoxia. And that's okay. We all know about it. The symptoms of the right heart failure include peripheral edema, swelling, beginning in the feet and ankles. This is known as pidgin edema. If when a finger is pushed into the swelling, it causes a small depression or pit. We all know about this. We know all the grades and the situation. You know, right side, bounce blood in the lung. Failure happens because of increased pulmonary vascular pressure. We know this situation. Also, just for information, I get the vocabulary, the picture that I like it. It's so funny and it's so clear, even though while they're talking and explaining us that situation. So examining the heart and circulation, of course, the clinical findings we are going to check, we are going to look for, and please, Bernarda, can you read this, please? This one?
Examining the heart and circulation, look at lips, tongue, and nails from the blood discoloration and cyanosis. Cyanosis may be central or peripheral.
Peripheral, right? And the tongue. Okay. Please, can you continue, Bernarda?
Inspect the hands and clothing.
Yes, clubbing.
Clubbing. Feel the radial pulse and the wrist and note the rate. For example, 70 minutes.
Yep, beats per minute.
And regular or irregular. The pulse may be irregular in force as well as time. Check that the other peripheral pulse and present.
Yes. Present. Yes, thank you. The rhythm, don't forget it. This is rhythm, right? Well, measure the blood pressure, the BP, and assess the jugular venous pressure, JVP, okay? Palpate the chest of the apex beat. The normal position is the fifth left intercostal space on 1 centimeter middle to the mid-clavicular line. Heart size might be measured by percussion, and we have all the spaces explained here. Feel for any trills. Listen to murmurs and other abnormal sounds. For example, friction rubs, beginning at the mitral area. Murmurs may be soft or loud. A harsh murmur is loud and rough. Of course, we know that we must practice these kind of expressions, right? This is the specifically medical vocabulary that we are looking for. We have our mnemotechnics, ape to man, that is so important for the evaluation. Of course, we know it. And our chart with pathologies. Now, let me see. Mario, did you go back? No.
Yes,
Mario,
I'm here.
Yes, please read the chart.
Okay, we have heart and we have congenital heart defects. We have coronary artery disease or CAD, atherosclerosis, ischemic heart disease, myocardial infraction, heart failure, carditis, cardiomyopathy. Myopathy.
Yeah.
Heart valves, cardiac arrest and arrhythmia, atrial and ventricular fibrillations.
Yes.
We have blood vessels abnormalities, vasculitis, and angiostenosis.
Yes.
Hemangioma, hypoperfusion, And in arteries, we have aneurysm, arteriosclerosis, and arteriostenosis. And in
Perfect.
veins, we have chronic venous insufficiency, we have phlebitis, and
Phlebitis.
varicose veins. In
Perfect.
thrombosis and embolisms, we have thrombotic occlusion, coronary thrombosis, deep vein thrombosis. In peripheral vascular disease, we have peripheral arterial occlusive disease and Raynaud's disease.
Perfect.
In hypertension, we have essential hypertension, secondary hypertension, we have malignant hypertension, hypotension, and orthostatic hypotension.
Perfect. And of course, thank you, Mario. And of course, we have our abbreviations that are related to this topic, okay? As I was telling you, these are the most common ones. And of course, we are not going to use all of them all the time. While we were talking, we were having, we were talking about it. We know that when we make our clinical history or medical report, we can use them. Of course, getting into the context and getting that the idea is going to be understood for the one that is going to read this situation without checking the patient. So a good idea is to make the first, at the beginning, just a key maybe for completing this. And that's a good way of communication with colleagues. Please study them, and I'm going to use it in the way I consider they are necessarily. Of course, not all the time, because it could be confusing with the other systems. Okay, so check them, take them as a good key for reading, though. By reading, you can find these abbreviations everywhere. Let's talk about the urinary system. Claudia, are you there? Do you have enough time now? I know you are working. Maybe she's with patients. Let me check. Well, I don't know. Well, let's go ahead. The urinary system, we know that the principal function is to filter blood and create urine as a waste byproduct. The organs of the urinary system include the kidneys, renal pelvis, ureters, bladder, and urethra. Okay, we have our first anatomical review. I think it's okay for the purpose because we can check all the inner organs and we have the correct way of writing down. And I think it's okay. We have the structures of the male urinary bladder, of course, with the openings of ureters into bladder, the internal urethral urinary sphincter, the prostate gland, the external urethral urinary sphincter 2, and the urethra, okay? And we have the cross sections in the male and female urinary systems for checking again the general anatomy view. No, not as in the beginning of the course. I showed you a complete picture, a very confusing one, but I think for the purpose, it's okay this one. Now we have the structures, combining forms and functions that I'd like a volunteer for reading. Who wants to do it? Hi. Maybe Fabiola. Claudia or Belkin, I don't know.
Claudia, go ahead.
Okay, thank you, Belkin. Claudia, please read this chart.
What?
Yes, the major structures relating combining forms and primary functions. Can you see this? This slide?
Yeah. Okay. Kidneys. Nephron, renal. Filter the blood to remove waste products, maintain electrolyte concentrations, and remove excess water to maintain the fluid volume within the body. Renal pelvis.
I don't know how to say that.
Piel or pielo.
Pielo. Collects urine produced by the kidneys. Urine. Uro. Urino. Liquid waste products to be excreted. Ureters. Ureter. Transport urine from the kidneys to the bladder. Urinary bladder. Cysto. Stores urine until it is excreted. Urethra. Transports urine from the bladder through the urethral meatus, where it is excreted.
Yes, it's meatus, please.
Meatus.
Yeah.
Meatus. Prostate. Prostate. A gland of the male reproductive system that surrounds the male urethra. Disorders of this gland can disrupt the flow of urine.
Perfect. Thank you so much, Claudia. So again, with our word parts, I got the correct information with prefix and suffixes. We know all of them, of course, and just for checking and having a correct idea of writing down and getting the correct interpretation, okay? The urinary symptoms. I decided to use this conversation because it's very interesting how it's focused on the situation, right? Any volunteer for reading? I'm taking account.
Me?
Okay. Who said, I'm sorry, I couldn't read the name as soon as.
Me, Fabiola.
Hey, Fabiola, thank you so much, Fabiola. And anybody else? A couple for getting in couple.
I can read.
Okay, thank you, Ruth. Please do it. And Fabiola, you can be the doctor, and Ruth, you are Mr. Jones.
Okay.
Okay. Are you having any trouble with your waterworks?
Waterworks. I'm sorry.
Okay, waterworks.
Well, I do seem to have to go to the toilet more often than I used to.
How often is that?
It depends, but sometimes it's very hour or even more often.
What about at night? Do you have to get up at night?
Yes, nearly always 2 or 3 times.
Do you get any burning or pain when you pass water?
No, not usually.
Do you have any trouble getting started?
No.
Is the stream normal? I mean, is there still a good strong flow?
Perhaps not quite so good as it used to be.
Do you ever lose control of your bladder, any leaking or dribbling?
Well, perhaps a little dribbling from time to time.
Have you ever passed blood in the urine?
No, never.
Okay, thank you, you couple. It's bladder, please. Bladder, like opening the mouth, bladder. Okay, in this conversation, we can see how doctor is asking about a specific situation, a specific symptoms, and the answer of the patient, of course, it's important because we have the way of expressions, the new words for keeping in mind and keeping the correct writing down way, like dribbling, leaking, or lose control, okay? The past blood, past pus, maybe, past something different from urine, something with another color. It depends on creativity while asking to the patient. And the most common symptoms, we have them as an information chart. And of course, we need to get as a correct way of working on them, okay? Johan, are you ready for reading? Can you do it now? Johan is not here. Well, maybe Catherine, can you read this chart, please?
Yes, teacher.
Yes,
Frequency, frequent passing of urine, dysuria, urine. Okay.
Yeah.
Dysuria, burning or scalding pain in the urethra when passing urine. Nocturia.
Nocturia.
Urination at night. Urgency.
The urgency.
Urgent need to pass urine.
Hesitancy.
Difficulty starting, to pass urine, urinary incontinence, involuntary passing of urine, hematuria.
No. Hematuria. Just it's very similar like in Spanish. Hematuria.
Hematuria, macroscopic blood in the urine.
Perfect. As I was explaining you, this combination A and E is the England's way of writing down. That's okay. In the United Kingdom, we are going to find this writing down, and in American books, articles, I mean, without it, just hematuria, right? Both of them are correct, so there's no problem. About urinary tract infection, the UTI common symptoms, as we were listening, Catherine, we have muddy urine, blood in the urine, frequent urination, abdominal pain, of course, bad smell of urine, fever, feeling unwell, burning when urinating. So we must check these situations for having our reports. And one of the most important activities in our daily job, the urine analysis of the urine. Now, who wants to read it? Actually, I have all in participation, all of you, in a great way. Who's a volunteer for reading this chart, please? Anybody wants to do it?
I can do it.
Yes, go ahead, please, Ariana. Or Joyce, I don't know.
This is Joyce. Okay. So, analysis of urine. A simple screening test of the urine are carried out with the region strips. More detailed tests are carried out in a laboratory on a specimen of urine. Typical specimens are midstream specimen, MSU, and a catheter specimen, CSU.
Yeah.
Microscopic examination may reveal the presence of red blood cells, pus cells, or casts. Casts are solid bodies formed by protein or cells.
Yes.
Plus signs are used in case notes to indicate abnormal findings. A small amount plus is described as a trace. For a large amount, 3+. The words gross or mark can be used. When there is nothing, the word nil is common.
Yes, the nil is, there is nothing important. Yeah, it's clear, it's clean. Here we have lots of vocabulary talking just for one lab study, lab test, right? So now it's time for practicing and reading. The midstream specimen, of course, the one we take to the lab, to the laboratory from home, or the catheter specimen that is taken by the health providers, right? Usually in the laboratory station, there is a specific responsible for taking this kind of of the specimen, I mean, and then getting the correct evaluation and that. The urinary tract infection, infection in any part of your urinary system. We have this chart for having an idea and remembering the vocabulary. Pyelonephritis, kidney infection, urethral infection, cystitis, bladder infection, urethritis, urethral infection, prostatitis in male, prostate infection. Bacteria travel up the urethra. We have to remember this, okay? The vocabulary I think here is so well, we were checking it all this presentation, and it's not hard, but for having an idea, I think it's okay. And we have our pathology chart. Does anybody want to read it? Maybe, I don't know, who wants to do it?
I want to do it.
Yes, thank you, Belkin, go ahead.
Stones, nephrolithiasis, nephrolite, systolic, urethers, hydroureter, ureterectasis, urethorrhagia, prostate gland, benign prostatic hyperplasia, prostatins, prostate cancer, prostatitis, urinary bladder, cystalgia, cystocele, interstitial cystitis, vesicovaginal fistula, neurogenic bladder, urethra, urethorrhagia, urethrorea, urethrostenosis, abnormal urethra openings, epispadias, hypospadias, urinary tract infections, cystitis, pyelitis, pyelonephritis, urethritis, urination, anuria, dysuria, enuresis, oliguria, polyuria, urinary hesitancy.
Hesitancy.
Hesitancy, sorry.
Yes.
I can see the last one.
Urinary retention.
Thanks. Incontinence, urinary incontinence, overflow incontinence, stress incontinence, overactive bladder.
Yes, overactive bladder, right? And when we have the itis suffix, we said itis, cystitis, pyelitis, pyelonephritis, okay? Urethritis. So that's great, Vicky. Thank you so much. And of course, our abbreviations for practicing, for getting the common situations. In this chart, I didn't written down about kidney injuries, kidney pathologies, because it's from another specialty for nephrology. So I think I can prepare a very brief presentation because it's out of program, this topic, but I think it's important, okay? This one we are going to study, to check, and of course, for example, pyelograms or, I don't know, studies, I mean, transurethral sections. Well, these complete specific situations we are going to check during the module 2, but it's important for us to get an idea about the writing and the abbreviation. Lots of abbreviations are used while talking about the lab tests, imaging tests on any kind of studies. And that's great. I think that we could start doing it. The catheterization is very common. Benign prostatic hyperplasia, BPH is very common, usually in Spanish too. Acute renal failure in Spanish too. We use this almost the same abbreviation. Chronic kidney disease. Okay, so let's go to the next. And the last system, gastrointestinal tract, gastrointestinal system, gastric system is the same. And of course, I got the pronunciation for yours. Gastrointestinal tract. I think that's okay. Well, the organs that food and liquids travel through when they are swallowed, digested, absorbed, and leave the body as feces. These organs include the mouth, pharynx, throat, esophagus, stomach, small intestine, large intestine, rectum, and anus. We have the first anatomical review. Yes, it's possible for reading, so we must check it again. We have this picture that I like to match because we have the explanation of the function of every part of the that is signaled, I mean. And of course, inside these boxes, we have explanations and more vocabulary words for practicing, okay? Well, more anatomy parts. For example, these pink structures that we don't always talk about it, the gum, the gingiva, the labial frenum, that is important because always kids especially come with an lesion in this structure, the lower lip, the lingual frenum. Of course, when we have problems while talking, we have to check this structure. Palatine tonsil, dorsum the tongue, the uvula, labial frenum, the upper lip, again the gingiva or gum, hard palate, soft palate, and I think that's okay. The stomach and these structures. So more vocabulary, anatomical points of view, of course. And we have the accessory digestive organs, liver, gallbladder, and pancreas. And we are going to talk about it in another presentation because it's too much and now it's out of objective, I mean. And we have the division of the abdomen in order for making the correct evaluation, clinical examination. And of course, with the correct way of writing down both of those systems, the French and the England, and the abbreviations. These ones for the quadrants are very common to get watched and into the, I mean, into studies, into articles that are coming from Europe, especially. But in the American documents, you could find few of them, but this division with the 9 blocks is the most common one. Now we have the structures, combining forms, our common chart. Anybody wants to read it, maybe? Okay, maybe Agar, would you like to read it? Hi, Agar.
Yes, I'm here. Mouth or stomach.
Stomach, yes, stomato.
Stomato
Yes.
begins preparation of food for digestion.
Digestion.
Pharynx. Pharynx.
Yes,
Pharynx or pharyngo.
Perfect. The X is necessarily to hear the sound in pharynx. If you say pharynx, you are talking about a musical instrument. It's not pharynx? The same. Yeah, pharynx, yes. Thank you so much.
Pharynx, pharynx, transport food for the mouth to the esophagus. Esophagus.
The esophagus, okay, the esophagus.
Transport food from the pharynx to the stomach. Stomach, gastro breaks down food and mixes it with gastric juices.
Yes.
Small intestine, entero, mixes chyme.
Yeah, mixes chyme.
Chyme coming from the stomach with digestive juice to complete the digestion and absorption of most nutrients. Large intestine, colon, absorbs excess water and prepares solid waste of elimination.
Yeah.
an rectum, an anus, an ano, procto, recto, control the excretion of solid waste.
Perfect.
Liver,
Yes, the liver.
hepato, secretes bile,
Yes, secretes, bile,
secretes bile,
bile,
secretes bile, enzymes,
enzymes could be,
enzymes to aid in the digestion of fats.
Yeah, to aid in the digestion of fats.
To aid in the digestion of fats.
Perfect.
And the last one, gallbladder.
The gallbladder.
Gallbladder, cholecyst, stores
bile.
I forgot.
Yeah,
and release into the small intestine as needed.
As needed, okay. And the last one, can you see it? The pancreas.
Just
yes, thank you.
Pancreato secretes digestive juices and enzymes into the small intestine as needed.
Yes, secretes.
Secretes.
Yes, perfect. Thank you so much, Agar.
Welcome.
So let's continue. I think it's so clear. I mean, for practicing, it's okay. The word parts, prefixes and suffixes, of course, we know. And now talking about emesis, for example, we know that it's considered as a symptom and a sign, vomiting, and when we watch it, it gets into sign. The lithiasis, of course, we know it. Pepsia, fascia, procto, that's interesting. Now the examination of the abdomen, of course, we know the correct order. And well, first of all, inspection, the general inspection. Note if the abdomen is distended by fluid or gas. Auscultation, listen for vowel sounds. The vowel tract is going to be evaluated by that. The percussion is the presence of fluid can be confirmed by demonstrating shifting dullness, percuss or tap first with. I'm sorry, I cannot move this. I'm sorry, so I cannot see this because I have a chart. Okay, I'm sorry. Percuss or tap first with the patient lying supine, float on their back, and then ask the patient to lie on one side and percuss again. If fluid is present, the dull note hard on percussion moves. Then we have palpation. Palpate each region, feeling for tenderness, pain when touched, or masses, palpable enlargement of tissue. Note also any warding or rigidity, shown by contraction of the abdominal muscles. Warding may be due to tenderness or anxiety and can be reduced if the patient is persuaded to relax. Rigidity, however, is constant and is due to peritoneal irritation. Rebound tenderness is pain when the palpating hand is suddenly removed. It's a sign of peritonitis, I think we have lots of new words of vocabulary for checking and practicing. And we must talk about an important topic for our studies while during these evaluations, the GI tract, the feces, the stools, the poops, right? And we have several words of feces, several ways of calling it, several ways of expressions that's very common and that we must understand and translate because it could be a little embarrassing for patients to talk about these specific situations and topics, Maybe Ariana, would you like to read them, all the bubbles?
Yes, okay. There are several words for the feces. Doctors sometimes say there was blood in the stools. Have you passed last result? Patients sometimes say my emotions have been very loose lately. The vowel movement is used to refer to defecation. Have your bowels moved today? Have you had bowel movement today? Bowel habit is a medical expression meaning the pattern of defecation. Have you noticed any change of bowel habits? How often do you open your bowels? Are you going to the toilet more often than normal?
Okay, I mean, can you see the differences while asking in this way? Because it's not a very comfortable situation to talk about stools. They say, Wakala, why he's asking it to me? Why you are asking for it? And of course, it's important for the correct diagnosis and evaluation, but patients, in order they don't know the situation, they just say, Wakala, and we have to take it in count. Bowel movement is a very important topic, and this is just an example. If we get a better question, one that could be understood for the patient in the correct way, that's welcome, okay? Even for the bowel habit. This medical expression, change of bowel habit, the black one, is one of the most common ones. And I don't consider it could be a good idea to change it or to look for another combination of words, okay? This one is the same as how often do you open your bowels? How often do you go and poop? Are you going to the toilet? It's the same that open your bowels. The three of them show the same meaning. Or even talking about the Bristol stool form scale, it shows us the differences between the aspect and the clinical situation that could be associated for that problem, okay? And of course, when getting this information, we can continue having this as an idea. John Harold, can you read the paragraph, please?
Yes, teacher. Change in bowel habit could be constipation, hard, infrequent stools, or diarrhea, frequent soft or liquid stools. Normal stools are brown in color and semi-solid or form. The consistency or degree of hardness and softness can be shown on a scale. And then we have the scale.
The Bristol stool. As I was telling you at the beginning of this course, Americans and England's colleagues love to talk about scale, something in an objective chart that is organized for getting the same opinion for everybody. That's why I'm showing you scale and scale and scaling every topic, the most that I can find and the most useful ones. This one, for example, here in Bolivia, I don't remember that I got one. And when I was in the medical school, I didn't imagine there was this situation. So in order we are going to this class, we are going to have more and more scales, okay? It helps us a lot for having a document, for organizing ideas, for expressing and showing situations, for referring. According from Bristol scale, our patient is with constipation. And that's all. You don't have to give more explanation because the Bristol scale is giving the answer of the situation. That's the correct meaning I mean. What happened? Oh no, okay, I'm sorry. And of course we have this chart that is considering the color. It's another scale that it's not an official one, right, with a name like the Bristol one. But this one shows us the differences that in color we can evaluate for comparing in a clinical situations from black to light colored, okay? Any volunteer who would like to read it? Maybe.
I can read it.
Okay, Ruth. Okay, Ruth, go ahead, please.
The color can vary from black due to alert blood, as in amelena, or yellow, gray, or even white. Melena stools are often described as tarry, like tar, tarry, like tar. The black sticky substance that that is used in road making. The stools may be red when fresh blood is present. Blood that can only be detected with a special test is called fecal occult blood. FOB. Oh, food. When there is a high fat content, the stools are pale and are sometimes described as clay colored. Stools that are large in volume are described as bulky. A bad smell is described as full or offensive.
Yes. Okay, I think we have more vocabulary for reading. And of course, in the picture, we have the explanation of the clinical possible situation that goes through the color, right? So keep on reading. And now our custom chart of pathologies. Any volunteer maybe? Well, I know we are with lots of problem in connection, in the internet connection, but maybe Claudia or Fabiola, maybe could you read this chart?
Okay.
Okay, thank you. Oh, Fabiola.
Oral cavity.
The oral cavity, perfect.
Ulcer. Glossy. Herpes
labialis. Herpes labialis, yes, it's in Latin, as I was telling you.
Plaquia.
Yeah.
Stomatitis.
Stomatitis.
Okay. Stomatitis. Stomomycosis.
Perfect.
Oral thrush. Trismus.
Trismus, that's great. It's in Latin too.
Okay. Xerostomia. Cleft lip and cleft palate.
Perfect. Continue, please. Perfect.
Dysphagia. Gastroesophageal reflux disease.
Perfect.
Barrett's esophagus. Cirrhosis. Esophageal varices.
Yeah.
Hiatal hernia.
Hernia.
Hernia. Okay.
Okay.
Stomach. Gastritis or
gastritis.
Okay. Gastritis. Gastroenteritis.
Perfect.
Gastrorrhea. Peptic ulcers. Stomach cancer. Liver.
The liver.
Oh, liver.
Yeah.
Ascites. Cirrhosis. Hepatitis. Jaundice. Non-alcoholic fatty liver disease.
Perfect. Continue, please.
Intestinal disorders. Celiac disease. Colorectal carcinoma. Polyp.
Yeah.
Diverticulosis or diverticulosis.
No, yeah, diverticulosis. Just
Okay.
the same in Spanish.
Okay. Diverticulum. Diverticulitis.
Diverticulitis.
Okay.
It's not the same diverticulosis than diverticulitis.
Okay. Enteritis. Ischemic colitis.
Colitis.
Colitis. Elios.
Yeah, in Latin again.
Ileus.
Yeah, the ileus.
Irritable bowel syndrome, inflammatory bowel disease,
Okay.
ulcerative colitis, Crohn's disease, intestinal obstruction, infectious diseases of intestines,
Intestines or bowels, yes.
Clostridium difficile.
Difficile. Clostridium difficile, again in Latin. They like to make a mess.
Dysentery.
Dysentery.
Dysentery, salmonellosis, anorectal disorders.
Perfect. The Clostridium difficile, it's a very difficult situation of solving. It's a difficult, very difficult treatment to apply. And of course, a very hard way of through the disease and recuperation. It's so hard. Patients lose weight a lot. If somebody watch it and got the opportunity of attending a patient with this specific situation, know that the mortality is so high. Now we have our clinical conditions associated with cirrhosis of the liver. Of course, we have more vocabulary here. Now findings. So that's the objective of the pictures. Get them more and more and more vocabulary, of course, right? For example, splenomegaly is very common in this situation. Spider angiomas, very common in the abdomen, back, and chest. Testicular atrophy, sometimes. Skin hemorrhages, could be, but it's the last part of the process. The edema, I don't know, gynecomastia, that's great. I think it's a good way of studying. And our abbreviations more and more. I'm sorry for giving you lots of this information, but I think it's going to be helpful. And of course, we are going to start using this abbreviation. For example, the GI tract, the GI system, and try to write down with them, okay? And even talking, use them, that's okay. We are into context. And that's all. Let's read, everybody. It's a lot of information, of course. Any question you have until this point? Something you would like to punctualize? Something to share, maybe? Well, as a matter, if there is nothing new, yeah, nothing more to say, because it's a very long class, a very long presentation. Let's make the poll. I'm sending it now. It's for assistance. I have 2 classmates that lost connection and send me a message. I'm going to take it in count. And please do it in order to get your assistance into this class. Okay. Okay, 9, 6, 8, 9, perfecto. Okay, everybody, we all fill the pool. So that's all. Thank you so much for staying at the end. We took too much time. I'm sorry for that, but there is no another way for making this. And well, I hope we can work tomorrow with all of this material in the workshop, okay? Please check the vocabulary and any doubt you have. Tomorrow we can solve it. Okay. So,
thank you.
so see you tomorrow. Go and have a nice
Thank you. See you
resting
tomorrow.
time, reading time. I don't know. Yeah. Bye, everybody. Goodbye.
Bye, see you
Bye-bye.
tomorrow.
Tomorrow.
Bye.
Okay, bye on YouTube. See you tomorrow.